Today is Tuesday, February 9th, approximately 4 o'clock in the afternoon. I'd like to call this Board of Commissioners meeting to order. Madam Clerk, if you would take roll, please.
Here, Commission Chambers.
Monitor Township, here.
Coonan,
Here, Bay City.
Garrett,
Here, Bay City.
Becky,
Here, Commission Chambers.
Johnson,
Here, Commission Chambers.
Chair Krieger,
Here, Commission in the Commission Chambers.
all members present, thank you.
Thank you. So we'll stand for the invocation. After the invocation, I'd like to have a moment of silence. Our family at Bay County has lost a number of individuals. One in particular, Pam Lepke, who worked for Buildings and Ground. We have Vicki Beeson, who was married to Pat Beeson, past commissioner. And then, of course, we have Vicki Barsha, wife to Jim and huge supporter of Bay County. Some major losses. So.
People you have placed in our hands, the wealth we call our own. By your Holy Spirit, Lord, so that our prosperity may not be a curse in our lives, but an instrument for blessing. We ask that you will guide and give leadership to every member of this Board of Commissioners, and we ask that you will give them knowledge and understanding so that the decisions made today and always will benefit every citizen of this community. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
Well, the minutes have been distributed. A motion to approve would be in order.
I'll support.
Okay. Moved by Commissioner Fox, supported by Commissioner Johnson. Any discussion on the minutes? With none, all those in favor, roll call, please.
Sir, roll call today with Commissioner Johnson,
Yes.
Fox. Nick. Minute.
I think I'm frozen,
No, you're not.
Yes.
You're fine.
but I'm not moving. Or am I not supposed to see myself move?
I think you're fine, Greg.
Minute vote on minutes. Can you hear me?
Coonan? Did you call Coonan?
Yes, thank you. Can you hear me?
I
Not very
cannot.
good. Little echo.
Speak louder. Thank you. Herrick,
Yes.
Radke,
Yes.
Chair Krieger.
Yes.
7 yeas, 0 nays. Motion to approve minutes carries.
Thank you, Madam Clerk. Next, would citizens input. Is there anyone from the public that's Zooming that would like to address the board? Anyone from the public wish to address the board? That being said, before we move into petitions and communications, I'd like to give Joel Strauss an opportunity to come and give us an update of information and answer whatever questions the commission might have for him. Joel, are you on board? Mr. Strauss.
I am here, Mr. Chairman. I'm going to share my screen, and I have a few short slides to present to you and want to give you an update on the state of the virus today here in Bay County and some of the issues that we've had with the vaccination rollout as well. So one of the good news aspects in the last few weeks is that the number of confirmed cases in Bay County has dropped significantly. And if you recall back in November and December, we really had a deluge of cases. We were on we averaged about 200 cases a day from about the beginning of November through the latter part of December. But those numbers have dropped significantly. So as of today, November 9th, we're able to investigate all the cases of COVID-19 in Bay County. We still have some issues trying to get persons to cooperate with the investigations that we do, but for the most part, people do. We are able to test anyone that needs a test. We've even expanded testing into long-term care facilities with antigen testing, rapid testing, and into some of the public schools as well, especially for some of their sports programs. So that's going pretty well as in addition to that. The hospital capacity has really increased greatly. Those numbers have been cut by 2/3 since the beginning of December. On average, we have about anywhere between 12 and 17 people admitted into the hospital, but the ICU is not filled as it was back in December. And finally, our test positivity rate as of today is below 5%. And the number of cases per million over time on a daily basis is down significantly. If you recall back in November and December, when I reported to the board, it was over 600, nearly 700, and now that's down to about 70.8 per million. So that's a very encouraging trend. As I stated before, the test positivity rate has dropped. We are almost to levels where we were at our low point in September and early October. I'm hoping that we can get there, but I have some concerns about some of the new variants, and we'll talk about those in a few minutes. And correspondingly, the new number of new cases over time has dropped dramatically as well. Kind of correspondingly, it's a lagging indicator, but we did see the number of deaths sharply increase in the month of November and December. Those numbers have gone down pretty dramatically. And overall, there's been about a total of 250 deaths in Bay County due to COVID-19 in the last 11 months. But just to give you some perspective on that, the number 2 and 3 causes of death, which are cancer and lung disease, generally are about 200 cases per year as well. So we're on par in this coming year to see COVID-19 as one of the leading indicator, maybe perhaps the leading indicator of death in Bay County. To give you some perspective, though, of how we are doing today, we have a test positivity rate of about 3.8%. We're seeing on average about less than 10 cases per day. Sometimes it goes up more, sometimes it's much less. And our testing capacity is very, very good as of this point. If you compare our statistics with the state of Michigan and the region and some of the surrounding counties, we are doing exceptionally well at this point, in addition to that. So there has been a lot of movement on our front, and pretty much exclusively we have been focused on getting as much vaccine out to the residents of Bay County as we possibly can. Our goal this year is to vaccinate up to 72,000 people at 2 shots each, or 144,000 shots by 4th of July. That's a pretty ambitious goal, and we do realize that. This goal was put together back in latter November when we were instructed that the vaccines were coming soon. Once again, this is the largest public health initiative in this Bay County history, and it requires the coordination and cooperation of all the medical providers, just not on the health department. But we're working with other medical providers, such as the hospital, McLaren, Bay Region, other businesses, schools, governments, and other organizations. We've got significant partnerships with McLaren Bay Region. We talk to them on a daily basis. We've got a significant partnership with Delta College. We've opened up a drive-through site, vaccination site in the last week. That is operating 2 days a week. We wish it could operate more, and we'll talk about supply issues. But we're hoping to ramp up operations there fairly soon. We've got fairly significant partnerships with the ISD. we've been able to provide most, if not all, of teachers and childcare workers in Bay County with at least one shot in the vaccine regimen. We've constructed a partnership with Bay Area NAC Behavioral Health Agency and Region 7 Agency on Aging. And they are starting to provide vaccines out to the persons that they serve that have normally a difficult time in obtaining services. We have completed nearly all of the Tier 1A healthcare workers in Bay County. We expect that there are going to be stragglers in that, but most of those folks are already fully vaccinated. And we are full into Tier 1B, which is anyone over the age of 65, teachers and first responders. This is going to take a while, Tier 1B. And Tier 1B is divided into 3 subcategories. Tier 1BA, which is health persons over 65, teachers and first responders. Tier 1BB, which are other critical infrastructure employees. Tier 1BC, which also includes anyone else that's a critical infrastructure employee, especially private businesses. The state is providing guidance to us and changing their guidance almost on a weekly basis. But we are planning for progress with Tier 1B, B, and C with the Bay Area Chamber of Commerce and Bay Futures. And our goal is to target several large employers when the vaccine supply is sufficient. And we're able to do this, and then we can really ensure that local businesses can continue to operate without further interruption. But due to the supply issues, which we'll talk about in a minute, that's been put on hold. But we are still in the planning process with them almost on a daily basis. We are primarily a Pfizer vaccine county because of our deep freeze capacity here in Bay County. We do have some doses of Moderna that we are able to share with other providers, such as Great Lakes Bay Health Center, and those were Moderna was used to help vaccinate the teachers. So there's usually a 21 to 28 day time frame for completion of the 2 doses that are involved. But as we've talked about before, there are continuing issues with supply and demand. We have overwhelming demand at this point in time. There, as of the beginning of this month, have been 26,000 persons that have registered with the Bay County Health Department. That number increases on a daily basis. But the problem with this is that with 26,000 people waiting in a queue, we are often given 1,000, maybe 2,000 doses per week of vaccine to distribute by the state of Michigan. And the demand is always overwhelming our supply. As I've talked about before, there are supply issues going or taking place throughout the state of Michigan. And because of that, the state has amended their distribution guidelines. They've done this 3 times in the last week. It's now a population-based distribution. I was initially hopeful that Bay County would see significantly more vaccine because of our senior population. As you are aware, we have the highest percentage of seniors than any county in the state of Michigan. But due to our population side of 100,000 persons on average, and also due to the fact that the state is also calculating vulnerable populations into their index, they've changed that vaccine distribution mechanism. And so our vaccine supply remains at about 1,000 to 2,000 doses per week. The public health distribution has changed 3 times in the same time period as well. We were assured before that there would be overall a 70-30 split of vaccine going to local public health, 70% going to the health department and 30% going to the hospital and other local providers. That has changed as well. It's now a 60-40 split with coming to the health department, but that change has not occurred as of this week, and we hope that it does occur next week. In addition to this, you may have heard about increases in distribution nationwide, but they do not automatically translate into more supply locally. And I've described that already, and we'll describe that into some greater detail as we go forward. And finally, no matter what, how much hard work we lay into plans, there are continuous changes to long-term plans. And I want to note on one particular item, we've worked with the National Guard on several fronts to establish a presence at the Delta College site. They really, when we started with Delta College planning for this back in October, November, the goal was to have 8 lanes that people could drive through. Well, that was amended to 4, but we were able to come up with a plan to potentially scale up to 1,800 persons per day going through there. The National Guard liked that plan. They initially came out about 3 weeks ago, and we talked about this. They had talked about potentially doing a 6-week deployment here and doing a regional vaccine distribution clinic that is primarily drive-through. Within 3 days, that plan was changed to coming out on the 20th and the 21st of this month, where they would provide 3,000 doses of vaccine to residents of this region, whether 1,000 for Bay, 1,000 for Midland, 1,000 for Saginaw counties. We were notified yesterday that unfortunately, that clinic has now been postponed indefinitely because of other concerns with vaccine supply and distribution that are taking place outside of our region throughout the state of Michigan. So there are continuous challenges that we are presenting to us. So I want to talk about 3 issues specifically that we've heard a lot about, and I know that as elected officials, you have all heard some of these issues as well. Number 1 is registration and scheduling. First of all, there is no centralized registration and scheduling schema here in Michigan. No centralized place to go get registered or schedule an appointment. So you've got 83 counties with 83 individual systems. Some do a schedule first and then determine eligibility based on a registration. Others, like Bay County, register people first, and then based on that eligibility, reach out for scheduling an appointment. On top of those 83 different systems, you've got systems from local hospitals and pharmacies that are also registering people and providing appointments if they have the vaccine. But there are difficulties in sharing that information. So Bay County system is far from perfect, but we're trying to improve that on a daily basis. We register first and then schedule appointments after determining eligibility. Soon we're going to have email verification of registration and online scheduling. There are some significant challenges that go along with this, and it's not a perfect system. We understand that this system may be difficult, especially for people that don't have ready access to the internet. So we're working with our Department on Aging and other providers within the community to supplement for that. And there are limits to these improvements, and they're important to note, as I've noted before. But in the meantime, we still have manual scheduling, manual data input, manual phone calls, and email reminders that can go out to the greatest extent possible. Our biggest challenge overall is supply and distribution. So far as of today, there have been 14,400 doses administered in Bay County. 23,000 doses of those have been distributed. 100% of what is distributed to Bay County is given out within 7 days. We do have to hold back on some for second doses so that we can ensure that second dose requirements are met. That doesn't happen in every county. It's a significant problem that's happening in Saginaw County and other counties around the state, and the state is having to rearrange supply lanes in order to meet those challenges. And hopefully they will get those issues figured out soon, so that will open up the supply back again here in Bay County. Hospitals distribute to their subsidiary hospitals and partner sites. So I want to talk about the 23,000 doses that have been distributed and 14,000 that have been administered. So far, about 7,000 doses have been distributed to Bay County. About 5,000 have been administered. We're looking at, by the end of this week, about 6,500 doses will be administered overall in Bay County by the health department. The remainder of those come from McLaren Bay region and CVS and Walgreens. The hospitals, particularly McLaren Bay region, distributes that vaccine to their subsidiary hospitals. So those are hospitals in Bad Axe, in Caro, in West Branch, but they also provide it to their partner sites in Walgreens in Bay, Midland, Huron, Tuscola, and Ogemaw County for McLaren patients over 65 that have multiple chronic conditions. Not all of those people come from Bay County. They're from different counties, as McLaren accepts patients from multiple counties as well. So that needs to be taken into consideration. CVS and Walgreens has a significant amount of those doses that have been given to them as well, because they have a partnership with the federal government to vaccinate nursing homes, long-term care facilities, and congregate care facilities. I've been told that most of those nursing homes and long-term care facilities are supposedly done, but I've also been told by the state of Michigan that those homes that did not participate with CVS and Walgreens, or maybe were not picked up by CVS and Walgreens because of problems that they were having with staffing shortages, are to be addressed by the local health department. And so we're hoping that this situation is rectified very soon. That's one of the reasons why we're working with Bay Aranac Behavioral Health, so that they can go to some of these homes, especially where their clients and patients are residing, and vaccinate as much as possible. But we've also have started to encounter some of these homes or encounter some of these facilities and vaccinate their staff and their residents as well. There are national shortages that are taking place. I'm sure that you're aware of that. And we've already talked about the state of Michigan changing their distribution formulary. This has happened 10 times since the beginning of December. We expect that it will change over time as well. And the health department, as I've said before, for the next 3 weeks expects to receive about 1,000 first doses a week and anywhere between 1,000 to 2,000 second doses per week for the next 3 weeks. We also expect that by March, vaccine supply will start to grow again. The state will hopefully figure out their distribution problems, and especially with the second dose requirements that are taking place throughout the state, and that there will be, in addition to that, maybe 3 or 4 vaccine choices available, particularly Johnson & Johnson, maybe Novavax, and AstraZeneca as well. The last thing I want to talk about today as far as vaccines being an issue is community information and disinformation. A waiting list just isn't occurring in Bay County. I had a conversation with my counterparts in Saginaw and Midland County yesterday, and they are facing the same problems as we are. They have a sizable number of people on their waiting list. They're not able to reach out to those folks to confirm that they are on a waiting list. They have several people that have registered on their site, also at their hospital site, or via Myers or another pharmacy, and they are waiting to get vaccinated, but they haven't heard anything yet. Each system has a registration and scheduling system on their own, as I mentioned before. Each has waiting lists. Each of them have received complaints about waiting and confirmation of registration. In my daily conversations with McLaren, we talk about the problems that we're having with persons having a lot of anxiety about not being able to get vaccinated right away, or not hearing about their registration status. And this is also taking place with McLaren Bay region as well. And it's happening within other counties as well. One of the things as we go through our registration list, and what we've discovered is vaccine tourism is a real thing. We've got people from outside of the Bay County, outside of the region, outside of the state of Michigan that are trying to get on the waiting list. Some folks that we've talked to, even in the state of Tennessee and in Georgia and Indiana, have no problem traveling several hundred miles if they get onto a waiting list. And we tell them we prioritize Bay County residents and workers first, and then we will get to other Michigan residents and other regional residents as well. Right now, we're vaccinating more than 75% of the persons vaccinated now by the health department are over the age of 70, and that's going to be our focus for quite some time. Most people vaccinated under 65 were healthcare workers, first responders, teachers, and child care workers. So the one thing I want to clear up is that you can't just walk into a Walgreens, a Myers, McLaren and or the health department in one of our vaccination clinics and get vaccinated. You've got to be registered. You've got to meet the eligibility requirements. Everyone has waiting lists. There are times when, if there is vaccine left over after a clinic and we're having a hard time trying to get people on our waiting list to come in, that we will give it out. And we don't want to waste a dosage, but that's the exception rather than the rule. And just to, just so that we can also demonstrate too that the problems are happening throughout the country, not just the state of Michigan, is that these are happening everywhere. I know someone had mentioned that they knew someone in Western Kentucky that just walked into a large big box pharmacy and got vaccinated. And once again, that's the exception rather than the rule, if that did occur at all. There are people frustrated all over the nation with vaccine distribution. And that's a huge problem throughout all 50 states, not just the state of Michigan. Ironically, one of the best states with vaccine distribution is the state of West Virginia. And that is because they have chosen to go with a centralized registration and scheduling system. And it's open to anyone within the state. So while it's too late for us to go back and do everything over again in the state of Michigan, it's an important lesson for us to learn in the future. Now, the last thing I want to talk about today are the variants. You probably have heard more about this in the news. And there are 3 particular variants that are of concern to us right now. Number 1 is the UK variant, or B.1.1.7, the South African variant, B.1.351, and there are 2 South American variants, but one particularly the E484K. Now, each of these variants is more transmissible, especially the UK variant. It's about, it spreads about 50% more efficiently than the variant that we're used to here in the state of Michigan. It has been discovered in 4 counties already in the state of Michigan. We expect that this will be the dominant variant by the middle of March here in Bay County. Whether or not that it is more deadly is yet to be known. We do know that it can cause more severe illness, particularly because of its efficiency of spread. The good news about that is it seems to be responding to most of the vaccines that are available. The one variant that does not respond in total to the vaccines is the South African variant. And you may have heard that with the Johnson & Johnson studies that it's about 60% effective, especially for the South African variant. One important thing I want to note with that, though, is that it's only about 60% effective for preventing any kind of symptom. It's about 85% effective, at least within the first 2 to 3 weeks, at preventing serious illness and hospitalization. And it's almost 100% effective after about a month in preventing serious hospitalization and death. So with the new vaccines coming on, I'm fairly confident that these variants will be, we can address some of these variants. Having a much milder case of COVID-19 is better than having a severe case of COVID-19. And I think that with some of these new vaccines, especially Johnson & Johnson, which is a one-shot, one-dose regimen, we can really keep those numbers in the hospitals down and the death rates down as well. So at that, I'm going to end my discussion and open it up for questions at this point.
Are we?
Joe, Tom Herrick has a question.
Go ahead.
Joe, I'm had some people ask me after you've been vaccinated, what does it prevent, or what are you supposed to do? Do you need, if you're exposed, do you need the quarantine? You follow all the same rules. What exactly has to happen?
Okay, so after you are vaccinated, at this point in time, we still, if you are exposed to the virus, we still recommend quarantine. Not necessarily for yourself, but there's still an opportunity for you as a person that you could spread the virus if you have never had the virus before. Chances are, after you're fully vaccinated, if you're exposed and if you are going to be a positive case, it's going to be a mild case. We have not seen any indications with anyone after they've received full vaccination status of anyone becoming positive here in Bay County. Now that might change over the future, and that might change due to these new variants and their spread throughout the community. But at this point in time, you still got to wear a mask, you still got to distance, and you still need to quarantine if you're exposed.
Thank you.
Commissioner Fox, did you have a question?
I do. Well, can you talk about a little bit the longevity of the vaccine?
Sure.
How long do they expect to be effective for?
Yeah. It has just been published that the Moderna vaccine is thought to be effective for at least 12 months. And I suspect that Pfizer will come out with something similar as well. And we have not heard much about Johnson & Johnson or AstraZeneca. I do expect, however, that due to the chance of the virus mutating, and especially if it mutates into a more a stronger version of the virus, or one that's more transmissible, like the UK version of that, that we will see various tweaks and maybe booster shots, so that you might receive the vaccine, say for example, in February. There might be a booster available by summertime or early fall to help cope with some of these new variants as well. But generally, it's thought about a year.
And will we be able to then stay on the front end of that? Because it seems we got a lot of people to get vaccinated. Are we going to get through them all before we have to booster our highest risk folks?
I'm hoping that that's the case, and but it really depends on the supply chain at the national level and the state level.
Question?
Anyone else? Vaughn, go ahead.
Yes. My real concern is people who do not want to get the shot. I hear there's a large percentage. We need to get 70%. I know there's still misinformation out there, and make it through this whole process and not have herd immunity, and we'll still be wearing masks for like a long time. So there's some articles today about us never really being able to shed the mask unless we can get to that herd immunity. And I hear like 40%, 50% of people don't want to get it. Healthcare workers even that don't want to get it. So is there a PR campaign? I know there's a lot of stuff on the news, but I think a designated PR campaign might be necessary to really instruct people to get the shots.
There are definite PR campaigns that are happening at the national level and happening at the local level. But there's no better PR campaign than word of mouth. And a good example of that is healthcare workers. When the vaccine first came out at the end of December, it was about a 50-50 proposition for those people that were offered the vaccine, whether or not that they wanted it. And then once they discovered that those persons that did obtain the vaccine didn't have any significant side effects, the number of people that obtained the vaccine afterwards and for healthcare workers really rose substantially. So while, it's not 100% with Tier 1A workers, specifically frontline healthcare workers, it's a pretty significant amount of that population. One good example of the effect of that is that in McLaren, we get daily reports of how many employees are off with COVID-like symptoms on a daily basis. And during the high point of the spread in November and December, on average, there was anywhere from 45 to 90 employees off at any given time. That number's down to about 6 on a daily average now. And it's gone down even to 3. So we have not seen double-digit numbers for at least 3 to 4 weeks. So I think right there is a good indication of how well herd immunity can grow. And as the word gets out and as more vaccines become available, especially Johnson & Johnson, which might be a 1-dose effort and doesn't have the side effects as the mRNA vaccines, I think that we can get to the herd immunity fairly soon. Cautiously optimistic.
Anyone else have questions for Joel? Commissioner Johnson.
Yeah, hi, Joel. One thought, I know that our target, so you stated that, and so we're looking at, if we're going to reach that target, you're looking at about 5,000 vaccinations a week, and right now, of course, we're limited by the fact that we're only getting about enough for 1,000, right? So
1,000 new doses, yeah.
My question would be, when the number of vaccinations, when you're getting a better supply, do you feel that once that starts to roll in, that you're going to have an infrastructure with partnerships and everything else available to try and match that output?
Well, I think by March or April of this year, it will not only be the health department and its community-based clinics, which at this point in time, we're able to provide about 500 vaccines per day at the community center, and we can scale up to about 1,800 doses per day at Delta College. But you will also have Meijers, all the Meijer locations, the Kroger locations, Walmart, and you will have several independent providers and doctors' offices able to provide the vaccine. So I am cautiously optimistic as long as the supply chains increase, that by the spring of this year, we will see significant expansion in the number of providers and the number of doses per day.
Thank you.
Anyone else? Any other questions for Joel?
Ernie, I got one.
Go ahead, Kim.
Joel, I had heard that because of the mask wearing, the social distancing, hand washing, and things like this, that the rate of the flu has been reduced dramatically. Is that an accurate statement?
That is a completely accurate statement. That is absolutely true. And more people have gotten the flu vaccine this year than almost any other year that we've had before, too.
So even if we have to wear masks for who knows how long, it's a good thing. It'll reduce the rate of, and whether it's the virus or the flu or anything else, it's probably not a bad thing if you have to wear this mask for 6 months or whatever.
I think that there are a number of lessons that we have learned through this virus that we can take into the long run that will help us prevent illness and unnecessary deaths in the future.
Thank you, sir.
Mr. Chairman?
Yes, Jim.
Yeah, I'd like to follow up on Commissioner Begic's comment. If there's a way we can more fully inform through our county website, the rumors versus facts, because I know one of the things that I've been contacted about by younger women is that on social media, they're saying if you get vaccinated, you could lose your fertility. You may become infertile as a result of being vaccinated. So there's misinformation out there as we've discussed. And also, I just want to say, while the public is very frustrated with wanting to get vaccinated as soon as possible, and with the various tiers that take priority, there is some frustration there. However, everyone that has gone through the site, well, I wouldn't say everyone, but a number of people who have gone through the site have contacted me to compliment Bay County Health Department, yourself, Joel, and the staff for a very efficient and professionally run vaccination clinics. So the people who have gone through the process are very, very appreciative. And we do, as you mentioned earlier, have a large number of people anxiously waiting for their turn to be vaccinated. But as you've outlined, that's dependent on the volume of vaccine that we have available to us. How are we doing on the staffing, Joel, though? Have we had any, I know some retired nurses have said they'd volunteer and try to help in the vaccination process if we have the supply. How is the staffing going at the clinics, and is it sufficient in your opinion?
We are ramping up on staffing every day. And the good news is that we have a number of nurses that we've hired on a temporary basis throughout the community. And they have taken significant pay cuts in a lot of cases. You know, this is peanuts in comparison to what they make at the local hospital. But they believe in the mission. They want to do everything. There are some that don't even want pay. They just want to volunteer. So we've got a number of volunteers, and we're going to be ramping up our volunteer efforts as well, especially in anticipation that these clinics are going to expand exponentially. And you know, in the spring and the early summer, we probably will see, you know, almost a continuous operation at these clinics. And with that, you know, we've had a lot of good effort and a lot of good movement take place on staffing these things. Now, the one thing that frustrates us at this point is that we're still doing a lot of manual data input, and we are tweaking the system all the time. We're trying to find improvements where we can automatically upload information both to our electronic medical record and to the state's immunization registry. And we're hoping that we can get that situated and fixed fairly soon. But this is a problem that everybody's having throughout the state as well.
Thank you.
Anyone else for Joel? If not, I do just have one question. Joel, so if there's individuals that are watching this, may have questions or looking for more information, is there a website that they can lock into to review the status and what's going on in Bay County?
Okay, so they can always go to our COVID-19 webpage, which is on the Bay County website. If they have particular questions about their immunization status, or excuse me, their vaccination status, they can contact bchd@baycounty.net. We are hoping that by this week, we will have a confirmation email that will go out to everyone that has registered. And then as I mentioned before, that we will be able to begin the online scheduling system. I do want to note one thing about the online scheduling system that we are going to put into operation, whether it's this week or in the coming week. In other communities, even in Bay County with other providers, when they have done similar things and given out a link to a scheduling system, that link was shared beyond who it was originally intended for. And in the case of one of the big box pharmacies around here, they shared that link and it was spread widely beyond the intended targeted audience. So what happened was that it was supposed to be for seniors in a specific, from a specific provider with multiple chronic conditions. You're not going to be able to share that information. If I were to get this email that invited me to schedule and I shared it with you, Mr. Chairman, it would come up as Joel Strauss. You can't change it. So I do want to warn people about that, you know, it's not a clever thing and it's not helping anyone to share a registration link that isn't specifically provided to that person.
Very good. All right. Well, I appreciate your time and your information, and look forward to nailing this challenge if we can. So thank you very much. Let's move on now to petitions and communications. Under A, we have a public hearing request. We need to take care of some business dealing with the CARES Act. So a motion to go out of normal to have a public hearing would be in order.
So moved. Going in.
Support by Mr. Johnson. Roll call vote, please.
Commissioner Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
Herrick?
Yes.
Radke? Yes. Johnson?
Yes.
And Krieger?
Yes.
Public hearing passes 7 yeas, 0 nays.
Thank you very much. So we're taking care of the Michigan Community Development Block Grant dealing with CARES. And that would be dealt with the Finance Department. Jan, do you have anything to share?
Sure. Thank you, Mr. Chair. We are just looking for any questions that anybody has regarding the CDBG CARES funding. So this was one of our final COVID grants that we have outstanding. It ended December 31st of 2020. They have issued $281,714 to Bay County, in which we can actually pass some of that money down to the townships. We have contacted the townships, and we are currently working with Beaver, Frankenlust, and Williams Township. We're hoping to reimburse some of their unfunded COVID costs. Just so you're aware, most of the townships have their COVID costs covered from the additional grant that we had that replaced our revenue sharing. So we're just looking for final questions if anybody has them. If not, we will submit the final report and hopefully draw down enough to cover Bay County's portion of uncovered COVID costs. There are stipulations. They won't be covering everything, but we will be looking to draw down as much of our $150,000 that the board had given direction for us to spend on COVID-related expenses.
Very good. Any questions from the public or any commissioners? With that being said, a motion to go back into normal hearing would be in order.
Don't move, Coon.
Support, Begic.
Very good. Roll call, please.
Commissioner Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
and Chair Krieger.
Thank you, Madam Clerk.
7 yeas, 0 nays, motion carries.
Very good. Let's go into B, Bay County Treasurer. County Treasurer's public official bond status. A motion to receive would be in order.
So move, Coonan.
Any questions? That being said, roll call, please.
Commissioner Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
Motion carries 7 yeas, 0 nays.
Thank you, Madam Clerk. Under C, application for appointment to the Bay County Road Commission. We have a list of 11 applicants. I'll read them off and then a motion to receive these would be in order. We have Ray Van Driesch, Jacob Hilliker, Paul Wasik, Mark Chabanaugh, Thomas Lynch III, Michael Lutz, Timothy Quinn, Tom Ryder, Dennis Banashak, Joseph Rivet, and Michael Wisnowski. A motion to receive these applicants would be in order.
I'll make the motion to receive.
Very good. Any questions on this? If not, all those in favor signal by saying aye.
Aye.
I'm sorry, roll call again. Bad habit.
Commissioner Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays to receive the applications for the vacancy.
Thank you, Madam Clerk. So now let's go ahead and vote and see who will take over the last 2 years. Mr. Mike Rivard and Madam Clerk, if I'm seeing that I don't have,
Mr. Chairman,
yes,
can I make a statement, please?
sure, go ahead, Commissioner Herrick.
Yeah. I've been looking over this, and it's not often that, in fact, I remember no time where this board has made an appointment to an elected position like this before. We made, to a lot of different bodies, but never an elected position, because most of the time that has been handled by a different group of people, such as the case when the Register of Deeds left a couple of years ago. And I think in order, there's a lot of people that don't know everybody on this list. And, all we did was, we got a piece of paper, and which is what we usually get when we do some of the other things, some of the other applications that we receive for different boards, but not for an elected position. So at this time, I'd like to make a motion to refer this to the next meeting, so that in between we could meet all these applicants and let them present their case to the board directly, of what their qualifications are and why they should be on the get the board, the Bay County Road Commission seat. So that would be my motion.
I would support that resolution. Begin.
Discussion, Mr. Coonan.
Yeah, that to me sounds like a policy issue. And I don't have a problem if we're going to refer it, but we should set a policy that we follow for every appointment, not just this appointment, but for every other appointment that we may have. Just to do it for this, I'm not in support of. So I think, I've talked to just about all of the folks. We all know pretty much who they are. I don't think another month is going to make a difference. And I've heard that they are in need of that third person out there. So to delay it another month does not make a lot of sense to me.
Anyone else?
Chair. Yeah, it's Don Begich. So when I first came on the board, this is one of my issues, that we had these people presented to us. So I took upon myself to call all of them. I called all 11 people, talked to them, but I don't think that's the most efficient way. I think there should be a procedure for them to come before us individually or as a group. I think we need to make a policy. I don't have a problem voting now because I think they are in need, but I think we need to develop a policy of appointment that's different than what we do currently. So I'd be supportive of doing that. Thank you.
Mr. Chairman.
Yes, Mr. Herrick.
Yeah, this is a little bit different than what we usually do. This is, we haven't been in the situation where we've appointed to an elected position before to fill that I remember. Maybe you do. You've been a lot longer than I have, but I don't remember that. I can't remember this ever happening. And so that's one of the reasons, that I think this is a little bit different than some of the other boards that we appoint to, and I would, if our attorney had anything to throw in on this, I'd be happy to listen to her also.
So Amber?
Whether or not you have interviews for countywide elected positions is a procedure that can be agreed on by the board at any time. There's nothing in your board rules that dictate how you want to handle that. So, I mean, if you have a majority vote that says you want to have public interviews, you can have public interviews.
Chairman, I would, Mr. Chairman, I would make the point that we did appoint, Eugene Grisdala. We replaced him. He was elected treasurer. We had a vote to replace him with Mr. Tilley as a county commissioner. So we have done it. We have done it before.
That's correct. So it isn't anything new that we haven't done. Is any discussion with our 3 new county commissioners? Any discussion? Okay, so there is a motion to refer this made by Commissioner Herrick and supported by Von Begich. We'll have a roll call on it, please.
And we'll start with Commissioner Radke.
Yes.
Johnson,
Yes.
Fox,
Yes.
Begich,
Yes?
Coonan,
No.
Herrick,
Yes.
and Chair Krieger.
I would vote no.
5 yeas, 2 nays. Motion carries.
Very good. So at this point, we will need to discuss setting up a time with the commissioners to have these individuals come in And unfortunately, there will be another month delay in filling this vacancy. So hopefully, the individuals that are involved with the road commission now keep the ship going straight. Very good. Under reports and resolutions of committee, Ways and Means, we have Commissioner Fox.
I move Resolution 2021-11, the 2021 Marine Safety Grant Program.
Support?
Very good. That was Von Begic.
Yes. Sorry.
Any discussion? With none, roll call, please.
Commissioner Johnson,
Yes.
Commissioner Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, motion carries.
I move Resolution 2021-12, designation of Bay City State Park as a signature park.
Need a second?
Support.
Support from Kim Coonan. Any discussion?
I would actually like to invite Laura Ogar to just share
Sure.
a little bit about this.
Laura?
Yes, hi, can you hear me? Okay,
Yes. Yes.
okay, great, thank you. The Michigan DNR is currently taking public comment on their public land strategy for 2021 through 2026. And one of the goals they've listed is to create a signature state park called a signature park, where it would be a model for urban outdoor recreation. Their long-term strategy actually calls for creating 5 of these signature parks statewide. Under this 5-year plan, they're working on their first one, and it would be a park that they would recognize for additional investments. They'd be looking at kind of to form community partnerships and invest for, and they would create like alternative accommodations such as cabins or yurts at that park. They would have alternative type of outdoor recreational amenities, as well as, outdoor, concessions. And so the Bay City State Park is actually a very good candidate for this, because we do have a history of a lot of community partnerships with the DNR for improvements out at that state park. The Community Foundation in particular has been very active in making investments. And then we also, Bay County has a high participation rate in the recreational passport for our license tags, and the state has taken notice of that. And so this would be a recommendation to DNR to consider the Bay City State Park as their first signature park. And whether it's their first one or one of the upcoming signature parks, we would be a real unique opportunity in the state of Michigan for outdoor recreation. Any questions?
I think you said beach wellness too, Laura, didn't you?
I did, in fact, Commissioner Coonan. In fact, quite honestly, the work that has gone on through beach wellness at this Bay City State Park is really what kicked off early on the idea at DNR to look at community investments. Bay City State Park, because of the work for beach wellness, the grooming, the improvements, the Moby mats out there, DNR has recognized that they can get further ahead at some of these state parks when they have the community support and community engagement like you have, Commissioner Krieger, as well as Mr. Redmond, and as well as the Community Foundation, the Bay Area Community Foundation.
Anyone else? Laura, if I could, we've been involved with the park for a number of years now, and that 1.25 miles of shoreline that we have is the only access for our residents. And we have people that come from all over to our park to camp and to take advantage of the shoreline, as well as our nature trails and Tobico Marsh. What I would like to see happen, and I know it hasn't always been looked on fondly because of the funding, but I know that there are different organizations that are out there that have monies to be spent that I'd like to have happen here in Bay County. And we've talked in the past about having some type of a fishing pier that would actually go out into the bay, that would bring in some businesses and again, highlight the access that we have on the water here. So I would like to see something put together that would support further development and looking into a possible pier, seeing that we wouldn't use any general fund dollars, but utilize the monies that have already been put out there to help with natural resources. I think that would be a huge plus for us to be able to have that additional access. So if it's something that administration would look into and proceed with the DNR. They did buy that 360 additional feet there next to the waterworks, which would be a perfect spot for a pier to go out to give additional access to the bay. So I hope that that's something that we can consider and work with our local funding to make that happen. That being said, no other discussion. All those in favor, we'll go with a roll call vote. You almost got me, didn't you?
Commissioner Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
Eric?
Yes.
Radke?
Yes.
Johnson?
Yes.
And Krieger?
Yes.
7 yeas, 0 nays, resolution carries.
Thank you, ma'am.
Okay, I'm Resolution 2021-13, the 2021 light trap data contracts and mosquito control.
Support, Coonan.
Any discussion? Not seeing any. All those, we'll have a roll call.
Commissioner Begic?
Yes.
Coonan? Eric?
Yes.
Radke?
Yes.
Johnson?
Yes.
Fox?
Yes.
And Krieger?
Yes.
7 yeas, 0 nays, resolution carries.
I move resolution number 2021-14, the 2021 control materials bid for mosquito control.
I'll move that. I'll support that.
Supported by Commissioner Johnson. Any discussion? With that being said, roll call, please.
Commissioner Coonan?
Yes.
Eric?
Yes.
Radke?
Yes.
Johnson?
Yes.
Fox?
Yes.
Begic?
Yes.
And Krieger?
Yes.
Resolution carries 7 yeas, 0 nays.
I move resolution 2021-15, the 2021 tire shredding contract with environmental rubber for mosquito control.
Support, Coonan.
Discussion. With none, roll call vote, please.
Commissioner Herrick?
Yes.
Radke?
Yes.
Johnson?
Yes.
Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
And Krieger?
Yes.
Resolution adopted, 7 yeas, 0 nays.
I move resolution number 2021-16, additional COVID-19 funding allocations from Great Lakes Bay Regional Alliance.
Support, Begic. Sorry.
Begic?
Supported by Vaughn.
Yep.
Very good. Any discussion? No discussion? Roll call, please.
Commissioner Radke?
Yes.
Johnson?
Yes.
Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
Eric?
Yes.
Thank you, and Krieger?
Yes.
7 yeas, 0 nays, resolution passed.
I move resolution 2021-17, Michigan Department of Health and Human Services, COVID-19 funding allocation.
Support.
Discussion. That being said, roll call, please.
Commissioner Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Aaron,
Yes.
Radke,
Yes.
and Krieger.
Yes.
Resolution approved, 7 yeas, 0 nays.
I move resolution number 2021-18, Integrated Public Alert and Warning System Memorandum of Understanding.
Support, Coonan.
Discussion. With none, roll call, please.
Commissioner Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays.
I move resolution 2021-19, MIDC Arraignment Attorney Agreement for Indigent Defense.
Need a second?
So moved, Coonan.
Seconded by Commissioner Johnson. Any discussion? With none, roll call, please.
Commissioner Begic, please.
Yes.
Thank you. Coonan,
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox, Chair Krieger.
Yes.
7 yeas, 0 nays. Resolution adopted.
Thank you, Madam Clerk.
I move resolution 2021-20, Delta College Fitness Center Agreement. Support.
Any discussion?
Ernie?
Commissioner Coonan?
Yeah, I just like to say that this is a great program we put together a number of years ago when we put in a,
Our wellness.
this type of exercise for our employees, whether it's at the community center, Ice Arena, or Delta College. And we put together a program for our employees on their health, where they can go see Dr. Potts and what have you, and make sure that these folks do get their care proactively. And this program here, I think, has paid off, and it's just a great benefit for the employees. So every time that comes up, I just kind of like to let people know that over the years we've done some things to reduce healthcare costs, and this is one of them.
Very good. Anyone else? No other discussion? Roll call, please.
Start with Commissioner Coonan, please.
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
Resolution adopted, 7 yeas, 0 nays.
I move resolution 2021-21, payables.
Support.
Support by
Coonan,
Coonan. Very good. Any discussion? With none, roll call, please.
Commissioner Herrick,
Yes.
thank you. Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
Resolution passed, 7 yeas, 0 nays.
Thank you, ma'am.
And I move resolution 2021-22, the 2021 fee schedule revision for sheriff and juvenile home.
Support.
All right. Any discussion on this? With none, roll call, please.
Commissioner Radke, please.
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays. Carried.
Thank you.
I move resolution number 2021-23, budget adjustment, social welfare fund from the general fund.
Support.
Any discussion? With none, roll call, please.
Commissioner Johnson, please.
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution passed.
Thank you, ma'am.
I move to receive the analysis of the general fund equity, 2021.
Support.
Okay.
Discussion. With none, roll call, please.
Commissioner Fox, please.
Yes. Yes.
Commissioner Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, motion carried.
I move to receive Executive Directive 2007-11.
Support.
Begic?
Any discussion? Seeing none, roll call, please.
Commissioner Begic, please.
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, motion carried.
And lastly, I move to receive tuition reimbursement requests for Lee Fernier and Evan Griffiths.
Support, Coonan.
Any discussion? With none, all those in favor signal by saying aye.
Aye.
All right, roll call again. Bad.
Commissioner Coonan, please.
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, approved.
For Ways and Means, Commissioner Fox?
That is, my work is done.
Very good, thank you, nice job. Next, we have Personnel Human Services, that would be Commissioner Johnson.
Yes, thank you. First off, Ms. Fox, you were much busier than my portion of the agenda, so I'm almost jealous. Not really. A lot of my stuff is consolidated. So we will start with Resolution 2021-24. And this is a vacancy in the Bay County Clerk's office for a typist. It is a budgeted position. So I would move this resolution.
Support.
Any discussion? With none, all those in favor signal by, I'm sorry, we're going to do another roll call.
Commissioner Herrick, please.
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution carries.
Thank you, Madam Clerk.
All right, Resolution 2021-25. This resolution is a bevy of budgeted vacancies.
Yes.
That are upcoming or they are already anticipating the need to fill down the road.
Yep.
Most are due to either retirements or some resignations, some promotions within. So I would, and then of course, the seasonal positions, which makes me happy to see that we're getting ready to hire mosquito control and people for the golf course, because that means the spring is sometime anticipated.
Exactly.
So I would move this resolution.
So, motion and support. Any discussion? With none, roll call, please.
Commissioner Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution passed.
All right, Resolution 2021-26. This resolution is in regards to the possibility of hiring Alicia Wallace on a temporary basis to fill up to 280 hours to fulfill the position that she had retired from previously. I move this resolution.
Oh, sorry. Fort Begich.
Thank you, Vaughn. Any discussion? With none, roll call, please.
Let's start with Commissioner Johnson, please.
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Krieger, I'm
Yes.
sorry, Herrick.
Yes.
Thank you. Radke,
Yes.
Krieger.
Yes, thank you.
7 yeas, 0 nays, resolution adopted.
Thank you, ma'am.
All right, and I have some items to be received from the Office of Assigned Counsel. The 2001-2020 criminal appointments, November 2020 report, and the year-to-date for 2020. I move to receive these.
Support Herrick.
Very good. Any discussion? With none, roll call, please.
Beginning with Commissioner Fox, please.
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Krieger.
Yes.
Motion carried, 7 yeas, 0 nays.
And that'll be it for you, Mr. Johnson?
That's it for now.
Very good. Thank you, Mr. Johnson. Well done, short and sweet. So we'll move into Board of Commissioners. It would be Commissioner Coonan.
Yes, sir, Mr. Chairman. We have Resolution 2021-27, reports of the county executive.
Yes. Very good. We have support. Any discussion on the reports? With none, roll call, please.
Commissioner Begic, please.
Yes.
Coonan,
Yes.
Herrick,
Yes.
Johnson,
Yes.
Fox,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, carried.
Very good. Next on the agenda, reports to the county officials. County Exec Jim Barsha.
Yes, thank you very much, Mr. Chairman. I want to just give two updates. Joel, I took almost an hour updating us on COVID-19 and as usual did a very comprehensive explanation of our role in trying to contain the pandemic in Bay County and the region. I just wanted to say that my community dental centers is operating very, very efficiently and serving a lot of residents of Bay County with their dental issues, and it seems to be a resounding success from what I'm hearing from the community. Also, we worked on that with Joel's leadership and the board for a couple of years to get that clinic open. And then also I wanted to say the Center Ridge Arms, everything has been finalized on the approximately $9.8 million investment. Part of that going to the county general fund, a small part, a little over $1 million over a schedule. But also staff is on site and construction will begin on March 1st in just a couple of weeks to the 100-unit Center Ridge Arms affordable housing complex that we have out on Pine Road in Hampton Township. So we're very pleased. I want to thank the board and, of course, Amber Davis Johnson and Zach Brunette and all of the people who worked so hard, Laura Ogar, also on the environmental aspects. It was a real team effort to comply with all of the federal regulations and requirements. The first time, as you know, we went out, we fell a little short and then applied for a streamlined RAD conversion, which was successful. And we were one of the first in the country, I think first or second, to be approved under a new streamlined RAD conversion process by HUD and MSHDA. So I wanted to just thank virtually everyone who played a role in getting us to this point. And I think we'll have an affordable housing complex that is going to be dramatically improved and serve the residents who need affordable housing for, generations to come. Probably at least another 30 years, that facility should be going strong. So just wanted to give those two updates and thank the commissioners also for the acknowledgement of the 3 individuals who passed, especially my wife, Vicki, and of course, both the others. Pam Lepick had such a lengthy tenure with the county, and we miss her terribly. And then also Vicki, my wife, was my partner for 32 years and worked as hard at the jobs I held as I did. She was a true partner, taking incoming calls at home and working all the social media, campaigning, and very involved in seeing the county of Bay progress. Some of the progress we made at the animal shelter and the other golf course improvements, and was always at my side. And I want to thank the commissioners for acknowledging her passing, as well as Pam Lepick, as they say, who was a fixture, a known fixture to all of us who have worked in the county building for the last few decades. So terrible losses in the community.
Yep. And Jim, she loved Bay County as much as she loved you. And you had a lot of good years together. So well said. You're all set? Thank you. So let's move on to some unfinished business. We have an appointment that we need for Veterans Affairs Committee. And there would be 3 applicants that we need to choose from. It's a 1 4-year term.
Mr. Chairman,
Yes.
I'd like to, can you, Ernie?
Yes, go ahead, Kim.
Yeah, I'd like to refer this to next month so we can see exactly what we're doing, putting together a policy on appointments. I think we should treat every appointment the same way, not pick and choose. So I'll refer this to next month, and we'll put together a policy that we can use going forward for all our other appointments.
I'll support that. Begin.
Okay, discussion? So I think what we need to do then is we need to get with administration so that we can set up a process that would allow us to do the interviews via Zoom until things change within our area where we would actually physically have someone come in. So,
Chair,
yes,
we have a process in our rules,
we do.
and so we can just amend the rules by a sentence or 2.
Okay. With that being said, we'll have administration work with Deanne to be able to set up a time where we have a public notice on it so everybody knows that this is going on, and we would have these individuals Zoom in and be able to put this together. So within the next week, we should be able to come back to everyone with how we'll proceed to handle both the road commission and then the appointment for the Veterans Affairs Committee. Okay? So that being said, I need a roll call, please.
And the motion is to refer,
Yes.
including anything else?
Nope.
Okay. Beginning with Commissioner Coonan.
Yes.
Eric?
Yes.
Radke? Yes. Johnson?
Yes.
Fox?
Yes.
Bigick?
Yes.
And Krieger.
Yes.
Appointment referred.
Very good. Next, we would have anything under new business. Do we have anybody that has anything to be brought up? Commissioner?
Mr. Chairman.
Yes. Go ahead, Vaughn.
Just want to mention that the NACO conference, the National Association of Counties Conference, starts on March 6th. It's going to be via Zoom. I think it runs for several weeks. It's a very informative conference. I think Deanne sent something out on this already, but if you need any more information, I have information on it also. There is a fee, but generally the county pays for it if you're interested. So there is a registration that you have to complete, but very, very informative. broadband, they always talk about broadband. I know Ms. Fox had brought that up before, and there's all Health and Human Services. I'm on that subcommittee, so there are committees that you can get on also. So I would encourage you to attend the conference via Zoom. Not as much fun as being there, but.
Thank you. Anyone else under new business? That being said, miscellaneous? Anything? Nothing on miscellaneous. Under announcements, we do have some appointments coming up. In March, we have 3 terms that are coming up, that being for Bayonne Behavioral Health. In June, we have a library board, 1 5-year term. July, we have a jury commission. It's a 1 6-year term. In October, we have a Langen Bank Authority, a 1 3-year term. We also have Department of Health and Human Services Board of Directors. It's a 1 3-year term. And we have a Board of Canvassers. It's 2 4-year terms expiring. And then in November, Building Authority, it's 2 6-year terms. And in December, Veterans Affairs, 2 4-year terms expiring. And then in December, we also have the Department of Aging Advisory Committee. There are 4 2-year terms expiring, and that would be in districts 1, 3, 5, and 7. Okay, so we got a lot of stuff coming up this year. Next, Ms. Johnson, as in Amber, is there a need for a closed session?
There is not, Mr. Chair.
Very good. That being said, a motion to adjourn would be in order.
I'll move, Coonan.
Roll call, please.
Beginning with Commissioner Herrick,
Yes.
Betsy,
Yes?
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
Motion to adjourn carried, 7 yeas, 0 nays.
Thank you, Madam Clerk. We are adjourned.